What a great day to talk about pharma! This is Alvin Estaño, and I'll be discussing the history of pharmacology, only here in Vet Pharma 311. Let's go! The history of pharmacology. What does pharmacology mean? It is a term derived from the Greek word pharmakon and logos, which means medicine or drug, and study. The knowledge of drugs and their use in disease is as old as history of mankind. The birth date of pharmacology is not as clear-cut. Drug is derived from a French word drogue, meaning a dry herb. Incidentally, majority of drugs in ancient times were of plant origin. Pharmacological knowledge has been recorded for thousands of years across the world. The earliest known documentation of medical substances is the prehistoric Sushruta Samhita. Additional examples of ancient pharmacological records are the various papyri from ancient Egypt that date back to the 16th century BC. Here are famous pharmacological contributions of some countries, starting with India. Ayurveda, the oldest system of medicine, which is very popular in these days also, recommends herbal remedies and animal origin products for treatments of disease in man and animals. The term Ayurveda is derived from the Sanskrit word Ayur, meaning life, and Veda, meaning science or knowledge. The ancient physicians Charaka, Sushruta, and Vagbata pioneered in Ayurveda. One great example of Sushruta's work is the Sushruta Samhita. Sushruta Samhita is an Indian Ayurvedic treatise from the 6th century BC. It is an ancient Sanskrit text on medicine and surgery, and one of the most important such treatises on this subject to survive from the ancient world. Next is Egypt. Ebers Papyrus is an Egyptian medical papyrus of herbal knowledge dating to circa 50. He is a student of Aristotle. The most important of his books are two large botanical treatises, Inquiry into Plants and On the Causes of Plants. Pedanius Dioscorides. He compiled a 5-volume book in his native Greek, known in Latin as De Materia Medica, which was the first Materia Medica to be written. The book describes about 600 plants of medicinal value and provides knowledge about the herbs and remedies used by the Greeks, Romans, and other cultures. Claudius Galen. He advocated use of many herbal preparations or polypharmacy. He also described many formulae containing plant and animal drugs. He compiled this knowledge in 20 books, called as Galenical work. His theories dominated and influenced the medical science for well over a millennium. Muhammad ibn Musa al-Hawarizmi. He was the first physician to distinguish smallpox from measles through his clinical characterizations of the two diseases. He was also the first physician who systematically used alcohol in his clinical practice. He introduced the use of mercurial ointments and developed apparatuses such as mortars, flasks, spatulas, and phials. Paracelsus, regarded as the first systematic botanist, and is also credited for giving zinc its name, calling it zincum. He is the first to suggest that the purpose of chemistry was not to make gold, but to apply the knowledge against treatment of diseases. Valerius Cordus. He compiled the first pharmacopoeia and carefully described techniques to be employed in preparation of drugs. He is also widely credited with having pioneered a method of synthesizing ethers. He also identified and described several new plant species, and plant genus Cordia was named after him. During the next 3 centuries, the drug science took significant strides. Some notable landmarks are the use of cinchona bark or Peruvian bark by Spanish explorers of Peru in treating malaria in 1630. Discovery of prophylactic immunization against smallpox by Edward Jenner in 1796. And the discovery of hypodermic syringe by Alexander Wood in 1853. Next is François Magendie. He developed experiments to study the actions of drugs on animals' body. He also studied the effects of IV injections of plant drugs ipecac, morphine, strychnine, quinine, and etc. on animals. He is known for describing the foramen of Magendie. Claude Bernard, father of experimental medicine. He is known for his discoveries concerning the role of pancreas in digestion, glycogenic function of liver, and regulation of blood supply by vasomotor nerves. He identified the site of action of curare, arrow poison, and used curare, strychnine, carbon monoxide in his studies. Rudolf Bockheim, father of modern pharmacology, founded the first pharmacology laboratory in the University of Dorpat, Estonia in Germany. He described the actions of drugs at cellular level in relation to their therapeutic use. He also conducted extensive researches in his laboratory to elucidate actions of drugs within the body. Oswald Schmidberg. He became the first professor of pharmacology at the University of Dorpat. He emphasized pharmacology as a separate discipline as the study of changes in living organisms caused by chemicals. His work primarily dealt with finding the correlation between the chemical structure of substances and their effectiveness as narcotics. John Newport Langley. He determined that adrenomedullary extracts elicited responses in different tissues which were similar to those induced by sympathetic nerve stimulation. He also proposed in 1905 that a receptive substance was the site of action of chemical mediators liberated by nerve stimulation. The genesis of the concept of chemical synaptic transmission has been attributed to Langley. John Jacob Abel, father of American pharmacology. He was appointed as professor of pharmacology in Medical School of University of Michigan in 1890. He is known for the isolation of epinephrine in 1898 and later of insulin in crystalline form. He founded the Journal of Biological Chemistry in 1905 and Journal of Pharmacology and Experimental Therapeutics in 1909. Sir Ramnath Chopra, father of Indian pharmacology. He laid the foundation of scientific investigation on Indian indigenous drugs. He became the first professor of pharmacology in India at Calcutta School of Tropical Medicine. He was the founder of the Drug Research Laboratory at Jammu, India. Lastly, we have L. Mayer Jones, father of modern veterinary pharmacology. He authored the first edition of Veterinary Pharmacology and Therapeutics in 1954. He was instrumental in shifting emphasis in the veterinary curriculum from materia medica to the modern science of veterinary pharmacology. That's all for now. I hope you learned something in this video. Pharma, see you!